So I'm going to introduce the panelists and then we'll start our discussion. Bill Cahalan is a clinical psychologist who has worked with clients in outpatient and inpatient psychiatric settings for over 40 years. He resists a mental illness brain disorder approach to most mental health problems, including psychotic experiences, and favors interpersonal and community-based ways of working with people. Nicole Lamberson is a physician's assistant residing in Virginia, as well as a patient with lived experience. Nicole was prescribed psychotropic medication in her 20s for mild work stress. The medication caused adverse reactions and a severe withdrawal syndrome, which has persisted for years and through today. Nicole volunteers with many organizations and initiatives focusing on this problem, including doing outreach for the Medicating Normal documentary. Angela Peacock is a U.S. Army veteran. Her story was featured in Medicating Normal, and she works doing outreach for the film as well. She is a mental health advocate, a writer, and YouTube creator who travels in her camper van across the United States with her service dog, Raider, to improve the mental health care system for veterans and civilians alike. Now I'll pass the floor to each panelist to give them a chance to say a little bit more about themselves, and then we can start our discussion. While the panelists are introducing themselves, those not on camera should feel free to go ahead and start typing their questions in the chat box. Anyone who is on camera may raise their hand if they have a question or comment to share. And we'll begin the discussion as soon as our introductions are finished. So I'll turn it over to our panelists. Bill, do you want to start?
Yeah, okay. Well, as Fred said, I'm a clinical psychologist. I've been working with clients in therapy for about 45 years, really. I'm 76 now and I'm still working part-time. I can't seem to let go of it. But I've worked in 5 inpatient settings, psychiatric hospitals and inpatient settings of all kinds. And I've also worked outpatient in clinics and in private practice. And I especially have been interested in people undergoing serious breakdown, what gets called schizophrenia or psychosis. I am against many features of the medical model. I think the medicine critique that the film presents is great. I think to really address it, though, we need to look at the system, need to look at the psychiatric pharmaceutical system and the history of how we got to this place. So I'm against the brain disease mental illness model. I don't use the word mental illness. I think it's not accurate. It's not helpful to use that word for disordered living, disordered experience, troubled experience. So that's enough for now.
Okay, great. Thank you, Bill. Nicole, you want to go next?
Yeah, sure. I just want to say thank you for having me. I'm here and happy to answer questions about my story. I trained as a physician assistant. I'll say that in my medical training, there was exactly 0 about the potential for medications to cause physical dependence or severe withdrawal syndromes. So, of course, that's part of the reason I took them myself as a patient. I didn't know that this was possible, certainly not to the extent that I suffered from these medications, or I never would have taken them in the first place. I was prescribed them in my 20s for mild work-related stress. Looking back, you know, if I would have known what the outcome of taking the medications would have been, I would have never taken psychiatric drugs and would have done things completely differently. All of the coping skills that I actually had to learn to get off of medications and to deal with the horrific withdrawal syndromes probably would have worked for me having work stress, like exercise, eating better, talking to people, yoga, those kinds of modalities. I didn't try them when I had the work stress, which I, can take some responsibility for, but also it was never suggested to me. You go see a psychiatrist or a doctor and you complain of stress or insomnia or things that we as human beings all feel and experience from time to time. And a lot of times you are just given 5 or 10 minutes in the room and you're handed a prescription, and a lot of people go home and they just trust their doctor as the authority figure who knows what's best for them, and they fill the prescription. And unfortunately, in the 10 years now that I have been in withdrawal and suffering from now trying to stop the medications, I've met countless thousands and thousands of people who, had very minor life struggles and are now having really, really horrific time on the medications or trying to stop the medications. So I'm losing my train of thought a little bit, so I'm gonna wrap up and let Angie go. But I'm open and will answer questions about my story if anybody has anything to ask. Thank you.
Thanks,
Hi.
Nicole.
Hi, I'm Angie. You just saw part of my story in the film, and me and Marshall in our breakout room, he didn't recognize me, and I love when that happens because it lets me know how far I've come, So I had fun sneaking that on him. I'm almost 6 years off all medications. I have been terrified to even take a Tylenol because of my experiences. So now I have, I guess, learned the hard-earned lesson that I have to take care of myself and learn what works for me and find that secret potion that makes me get through the days and be okay. Because I guarantee you that I probably meet DSM criteria for about 8 different disorders, but I don't identify with those, and I do not seek meaning from, I guess, the system that hurt me to tell me how to cope with those things. So I live in a van. I'm in nature as much as possible. I like to watch the sun rise and the sun set. That helps balance my circadian rhythm. I eat keto and paleo as much as possible. And I treat myself when I can because that feels good too. I try to move my body. I walk a lot. I've taken up the new hobby of visiting national parks and just being present in nature in places that are beautiful. And that has helped me more than anything. So thank you for having me, and I look forward to hearing what the audience has to say.
Great. Thanks, Angie. So just so you know, the raise hand feature is under reactions. If you click the reactions button at the bottom of your Zoom screen, there's a raise hand function, but you can wave your hand too, and I'll just call on people. So does anybody have a comment or a question they'd like to throw out? Yeah, Deborah.
Well, I put it in chat, but this started to dawn on me. This is like the OxyContin problem. The big lawsuits that followed that, but we can't. In the film it showed it. You can't sue over certain prescription drugs when they're generic. And I'm like, I realize there's a lot of ignorance that's perpetuating this based on the pharmaceuticals pushing it. Then we have a lot of ignorance based on that pushing. But then you can't sue anyone for all the harmful effects that have happened. Any thoughts about that? I wanted to sue somebody.
Well, we interviewed Michael Baum from Baum Headland on our YouTube channel most recently, and he basically told me, because there's a lot of patients that want to sue, but it's so complex that, first of all, most patients aren't on just one drug, so you can't say it's just this one. There's always a mess, and it's like you're on 5 or you're on 7. Secondly, it costs a lot of money. So one case, the average person on disability can't afford a lawyer because you have to pay, for an expert witness and all these things. So then there's the class action thing, and it's that because the drugs are off label or they're generic, you can't sue because they're generic. So even when, so that's kind of what he explained. But even when I was going through it, I kept thinking like, how do I, it felt like there was like a loophole for everyone except for the patient. So the doctor can say, well, you should have read the pamphlet, or, you know, you took this willingly, or whatever, you didn't ask questions, I don't know. Then the pharmaceutical industry, because it's a generic drug, and then it's like, I can't sue the VA, and then I'm a mental patient, you know, under there, so they can't you know, we don't have insight, or what's that word for, like legitimacy, like our voice doesn't really matter because we are thought of as like lesser than, like you don't have the capacity to understand these issues, you know what I mean? So it's like you start out at a deficit, so no matter what, they're just going to say, you know. And that was, I don't know why I'm going on this tangent, but that was part of the reason why I didn't kill myself, because I thought if I kill myself, they're going to pigeonhole me as this veteran who is crazy, and she's one of the 22 veterans a day that kills herself, and that poor thing just suffered from post-traumatic stress and it got her. And I was like, that is not the narrative, you know? So that's just goes to show you like the complexity of all the different layers here between diagnosis and pharmaceutical company and doctors and the whole system.
Yeah, Nicole.
Thank you.
I just want to add to that, you know, I know someone in the UK who sued and he was successful. Now, lawsuits in the UK are a little bit different because they get a little more support, I think, for obtaining legal representation and stuff than we do here in the United States. I don't think they have to pay in the same way that we do, but that's aside from the fact. But what I'll say is that when you're injured by these medications, most people who are considering a lawsuit are incredibly sick. And so the task of just like gathering everything you would need to prove, you know, what had happened to you, and experts, and the person I know who sued, I mean, it went on for like 4 or 5 years before there was even any resolution to the case. And he would call and be so stressed out and crying and upset because the other side's experts would start diagnosing him with all kinds of mental conditions. You know, they're trying to do anything to make you out to be someone who is on the losing side of the lawsuit. And so like the immense stress of even going through suing over this, I think most people who are just that ill, they wouldn't even take it on.
Yeah, Anna posed a question in the chat. How do I hold someone accountable for malpractice?
I'd say, you know, my own thought about that in the previous question, which is related, is first of all, I didn't know that once a drug went generic that there couldn't be a lawsuit against the pharmaceutical company. But anyway, if that's true, well, I'd like to know how it happened, but I don't think this is the place to get into those details with the limited time we have. But maybe the best many of us can do is just the informed consent bit. This movie, getting this film, which I think is excellent, out there as much as we can, is one way of helping people to try to find some way to taper if they're already on the meds, or hopefully not to get on them in the first place. If they're, you know, I try to let my clients know who are on meds when they come to me or consider getting on while they're with me in psychotherapy, to be informed. So I tell them, some of them that I think are ready, about Robert Whitaker's book, Psychiatry Under the Influence. I think that's a tour de force about the whole system and how it's gone the way it's gone. I tell them about Will Hall's book, through the Icarus Project, from the Harm Reduction Guide to Coming Off Psychiatric Medications. And Mad in America website, things like that. But finding somebody to help you taper once you're on, people need help. And I was impressed in the film that Brianna got help from and was apparently able to accept it from Dave, her husband, who had been an engineer. He set up that whole system for how she would taper and how much when and what dates. if everybody could get help like that from people with experience, it might have to be more from peers. It even says at the end of the film, well, don't taper on your own, you know, talk to your medical professional. Well, the film showed plenty of reason why that often isn't going to be very successful. Many medical professionals have not ever helped anyone taper. They don't believe in it. They're not going to help you. So going to others, going to peers who are doing this kind of work, helping people taper, which is how Will Hall started. Now he's a therapist, but originally he was just a psychiatric patient and a peer. That seems to be the way to go. So if we can't sue, those other things seem to be maybe the best we can do at the time.
Nicole, can you tell them, Nicole's the co-founder of the Withdrawal Project. Can you tell them about it?
Yeah, so it's just similar to Bill, what you're suggesting. We gathered a whole team of folks, and a lot of us were just people who had been through this ourselves, and we sort of combed through all of the wisdom that exists amongst the layperson withdrawal community, which is basically online. There's, you know, hundreds of thousands of people online going through psychiatric drug withdrawal, and there's tons of just experience there from people sharing what worked for them, what didn't work for them. You know, some really smart people were made sick by these drugs, and so they knew how to read research papers and dig into the literature. And so at the Withdrawal Project, basically, we gathered as much of that wisdom as we could together, and it's sort of a companion guide for people who are embarking on this journey, who want to come off of psychiatric medications, and they can reference everything there and sort of learn what the layperson withdrawal community knows to help themselves through the tapering process. And I'll put the link to that resource in the chat, but it's withdrawal.theinnercompass.org.
Great. Thank you for that, Nicole. John had a question, and this relates to what you were talking about, Bill, about medical professionals' resistance to do this. But his question is, when are medical doctors going to offer withdrawal protocols for psychotropic medications? Any thoughts on that question?
I have some, because I was just talking about this last night actually with the different screening, and I'm kind of resistant to the idea of there being a one-size-fits-all protocol for this, because we're all so individual, our bodies react differently. Very few people are on the same drug for the same length of time. You know, how would they even research that? So I'm very cautious about that, and it illuminates a larger issue, which is that it's like part of my unlearning was learning that there is no expert out there. There is no protocol. There is no like one size fits all. We get emails all the time from people looking for experts and programs to go to, and they're not out there. And I'm kind of like partly grateful that they're not, because it's still the same problem. We're still perpetuating that there's somebody outside of me that's going to fix me. And part of the unlearning is learning that there's really not, and that might be a good thing. So I'm resistant to protocols, honestly. Nicole, do you have anything?
Yeah, I'll just say, I mean, there are some protocols that do exist, like for benzodiazepines. The Ashton manual is out there, and that's by a psychopharmacologist named Dr. Heather Ashton, who made a manual about tapering off of sleeping pills and benzodiazepines. And she said in her manual that it should be tailored to the individual patient, that her manual is just a guide. And so the patient and physician should use it as a template, but adjust it to each individual circumstance. Some people are going to need to go much slower. Some people can go as fast as the template, and some people maybe even a little bit faster. There are some good folks who are psychiatrists or medical professionals who unfortunately also became sick from these meds, and they're doing research and coming up with their own guidance. Mark Horowitz is someone who comes to mind who's doing a lot of good research on withdrawal. You can Google him and some of his papers. So there is, progress being made. There is guidance being written. But like Angie said, guidance is guidance, and it should just be used as that. It shouldn't be you follow something to the T. You should always adjust everything to your own individual circumstance and how your body feels as you are trying to withdraw, and hopefully you find a provider who is, if they're not fully informed about withdrawal, the best case scenario is finding one who is willing to learn. That's what I found. My doctor didn't really know that much, but she was good for me because she was willing to listen and learn and read all the papers and everything I brought to her. And so we kind of became this collaborative team, together. So that's best case if you can't find a doctor that already is, super, super educated on this problem.
Thanks, Nicole. Suzanne has a question. Is there still a peer support group in Cincinnati for those wanting to taper off of medications?
Well, there used to be. You guys, you other folks with Holistic Mental Health Network on the board, Fred and Deborah and Valerie and others might know more than I do about whether that still exists. One of our board members used to run a group held at the Quaker meeting. Do you all know?
Yes, that was Lori, and it was the Warm Network. And my husband and son went to it, but I don't think it exists. I mean, I know it doesn't. I'm wondering if there is a benzo support group here in Cincinnati. I have not tried to find one, but I would like to find one. Haven't tried.
There's a world, I know Lori was connected to, I think it's a worldwide benzo support recovery group, but it's all online.
Right.
Yeah, Angie just put the URL in the chat for the Warm Network.
Right. Warm Network, yeah.
I'm looking for the benzo meetup group because it's moved to Zoom, which is actually a very good thing.
Oh, it's moved to Zoom.
Yeah, it's moved to Zoom. There's one out of New York. I'm going to post the New York meeting.
Okay, thank you.
There's a few out there. There's an
I
international.
think, I'm sorry.
Oh, that's all right. Here's the New York one, and then I'll post the other one underneath it.
Okay.
I think we can get so caught up in talking about how to taper, which is important. I mean, people need the information on how to search for people to help and what to do in looking at the potential or the offer to get on psychiatric meds, that we lose track of what else can be done. What else can be done for healing while you're tapering or instead of being on psych meds? I like what Angie said she's doing. A lot of healing coming from her opening up to the natural world, but it sounds like she's doing that kind of on her own, not because anyone necessarily has led her and facilitated that. But I've been somebody who has worked on including nature in the healing process of therapy, the whole field of ecopsychology. So there's a lot written. Well, there's some, not enough written, but there's some written about it. I've written some things about that. But I've also done a lot of psychotherapy, not just one-to-one psychotherapy, but couples, family, group, milieu therapy in one psychiatric hospital. I had a hard time getting much help from the rest of the staff in doing it, but I was allowed to do it, to have ward meetings with these patients on this 30-bed ward. And I just think interpersonal connection and exploration and support can be so healing. And it doesn't, I see myself as a psychotherapist as doing something that hopefully clients will take away and begin doing themselves with their family members, friends, and neighbors in one way or another. One group that supports that is the National Empowerment Center. which was started largely by Dan Fisher, who had 3 psychotic breakdowns in his 20s, became a psychiatrist after that, and he's now in his 70s. But he and others developed an approach called emotional CPR, and you can find out all about it on the National Empowerment Center website. And with emotional CPR, the effort is to help people learn to take their inherently therapeutic abilities and to practice them with friends and members of the community, not just professionals, but just anybody. And I think we don't emphasize that kind of thing enough. Of course, the Hearing Voices Network is it Healing Voices or Hearing Voices Network?
Hearing Voices.
Hearing Voices Network is something that is peer oriented too, and supports that idea that we are such a socially fragmented and lonely society, and loneliness is so sort of epidemic in our society. We really need as much as that as possible, not just for those people with serious troubles. And I think we need to do a better job at studying that, learning about it, and communicating it, in addition to all this work on medication.
Yeah, we probably have about maybe 4 or 5 minutes more for questions, and then we'll start to wrap up. John, related to what you all have been talking about, John had a suggestion here and a question. Why don't they make a video about Angie's healthy lifestyle and include other survivors' non-medicated lifestyles?
That's a good idea.
Is there a sequel coming?
I like that. That's a really good idea. I was just talking to one of the filmmakers earlier about maybe a full-length documentary as a sequel isn't where we should go, but like little short vignettes. So that's a really good idea. I will tell the filmmaker that you said that. There's a lot of really cool stuff out there. I've become slightly addicted to podcasts and videos. And so I learn all about like biohacking and like how you can eat certain ways. Like my latest kick is strength training, like building muscle. So I bought a bunch of weights the other day and I've been throwing some weights around outside with my, bare feet. There's all kinds of really cool stuff out there. It's just people don't believe that it really does work because we want that fast fix now. I want to sleep tonight. I don't want to do this for 3 months before I can have a better sleep schedule.
Right.
So it takes work,
I'll add to that. I changed my diet because of withdrawal. I was trying to eat as healthy as possible to try to, support my body and healing. And it was the first time in my entire life that I stopped biting my fingernails. So I do, when I hear people say like, oh, like eating doesn't affect your mood at all, or it can't help anything. I just feel like people, they underestimate, I think, how much maybe for some of us, what we put in our body actually matters towards our moods and how we feel.
Yeah.
Anna has another question. She serves as a peer supporter, and she's curious where she could best serve in this movement in terms of, holistic mental health and prevention.
Well, I hope, I haven't been in any of the board meetings lately for Holistic Mental Health Network, but I hope we get back to our practice sometime of meeting monthly and having a go around of everybody in the group, occupy an hour of our time there, of our 2 or 2.5 hour time there. And so everybody there is, in a way, has the opportunity to give peer support during and after those meetings with people they meet. That's one idea.
Angie or Nicole, do you have anything to add to that?
I would say tell your story wherever possible. If you're in a professional role, advocate to your guild. So if it's like you're a social worker, the NASW, if you're a psychologist, APA, or if you're a psychiatrist, the other APA, talk to people in your family, let them watch the film. If you're a survivor, write your story up. There's several opportunities for that. Mad in America, there's videos all over YouTube. I did that. I made a video when I was 6 months off and I was suffering horribly, and it has almost 100,000 views and 800 comments. And I
Wow.
literally was just sitting on the floor in my living room, like scared to death, talking a mile, 80 miles an hour because I was having such a bad reaction. But and there's just comments and just people saying, oh my God, me too. That makes sense. This, I understand. So
Oh,
just tell your story. We have to, there's safety in numbers. And this is, every day people are getting prescribed medications willy-nilly. And I just especially during the pandemic, it has gone through the roof. And I just think about all these people that 10 years from now are going to be like, what happened? How did I get here? So just share wherever you can.
That's, that's very helpful.
Deborah has another question. She wanted to, and maybe we'll wrap up with this one. She's curious, are you getting any traction from the VA, Angie, in terms of your work?
No, I've been largely ignored by the veteran community. I've sent hundreds and hundreds of emails, and part of them, I'll defend them and just say everybody's busy and they might not see my email and it goes to junk email. Part of them, this is a critique of the nonprofit industry. If veterans become educated about what's really going on with them and they get better, we wouldn't need certain nonprofits. So they have a stake in keeping us kind of sick and disordered, right? So that's part of it. Another part of it, I think, is just they're not used to a film screening. It's just not a culturally appropriate thing. So they're kind of resistant to the idea of a film screening. My doctor doesn't even really believe me still. My general practitioner, I just saw her last week. She just, I don't know. She sent me to CBT therapy. So now I'm supposed to do that again. And I'm just I don't even want to, but it's they always want to help you. They feel bad that you're suffering. I'm thinking about submitting the paper that I wrote from a fellowship 3 years ago. I need to get that in a journal somewhere. I just haven't had the time to do it, but I don't know. It's always ever present to me that I need to be working on that. I'm just so busy right now. I can't. So I'm working on it is all I can say. It's going to take a while. Yeah.
Great. Thank you, Angie. I know we kind of have to wrap up our discussion now, but I want to give each panelist a moment or two for any closing thoughts or to mention anything about your work or your websites or anything else you'd like to share with everybody. Bill, you want to start?
Oh, gee, I don't know what else I can say. I'm just doing a small private practice now. I would love to see us, I've said this before at hosting mental health meetings, mental health network meetings, get a therapeutic household going. I think every community should have many, many therapeutic households unlocked as an alternative to psychiatric units in hospitals. I think psychiatric hospitals and units with 30 beds, like the ones I've worked on, most of them are inherently tend to invite an asylum mentality. Michel Foucault, the French writer, called it that. And I would love to see us get emotional CPR classes going. We had one class taught by Daniel Fisher when he came to town, one workshop. And I'd like to see us get, what is the approach from Northern Finland called? The approach to working with families, keeping people
Open dialogue.
Open dialogue approach. I would love to see therapists here getting trained in that to keep people out of the hospital in their families, in their communities when they have serious breakdowns.
Thank you, Bill. Angie?
Yeah, and then for us, we have on our website alternatives featuring, open dialogue, hearing voices, different alternatives to use. The Massachusetts has some pretty progressive programs, so they're listed. And then we have a psychiatric drug withdrawal section, so help for withdrawal, peer support websites listed. We also have a reading list, and we always like to say, don't believe anything you saw in the film or anything we said. Let this be the beginning of your journey in learning more about these things. But you all seem to know a lot more than the general public, so bravo for that. So yeah, and also we have a YouTube channel and Facebook and Twitter. where we post lots of articles, but we also have an interview series going on where me and Nicole interview some of the leading experts and people with lived experience and people with interesting stories to kind of bring out more of the topics that are presented in the film. So you can find all those on our YouTube channel or on our Facebook, and that's just search for Medicating Normal and you can find us pretty much anywhere.
Great.
Thank you.
Thank you. Nicole, any closing thoughts you'd like to add?
I don't think so. I mean, every organization I'm involved with was either mentioned or it's listed on the film's resources page. So you can go there and find a lot of good things to help if you're looking to learn more about this. But thanks everybody for having me tonight.
Yeah, thank you, Nicole. Thank you.
Thank you.
Thanks,
Yeah.
everybody.
Yeah, I want to give a warm thank you to all the panelists for being generous with your time, and especially to Angie and Nicole, and all your work on Medicating Normal and getting the word out and helping to educate the community about this very important topic. So thank you all for joining us tonight. We hope to offer future programs. We don't know what those will be yet, but you can keep in touch with us. And if you're not on our mailing list, you can visit our Facebook page and send us an email and you can get on our mailing list. So I want to wish you all a good night and thanks for joining us.
Before,
Okay, take
before we hang up really quick, did anybody have trouble viewing the film? Was it choppy or slow? Can I just get a raise of hands if you had trouble?
It was a little choppy at the beginning for me, but then it cleared up after about 3 minutes.
Okay, Bill, how was it for you?
Yeah, the video was kind of choppy. The audio was fine. Video tended to have choppy phases all through it, but I got used to it.
And at some point there were squares of gray squares, but they didn't last very long.
We know that was because people were joining late. And so Nicole had to quickly try to get them off the screen, but that's what happens when they join. But I was wondering about anybody else. Terry, did you have trouble or was it okay? No, it was fine. Okay. We're trying to figure out if it's one of our computers or if it's Zoom doing it. We can't, or a Wi-Fi. We can't do it. But if people had fine, that means it's not Nicole's computer and it's not her Wi-Fi. But I don't know what it is. Okay, so we're just trying to figure it out. All right, thank you so much.
Okay, great.
Okay,
It was
sorry.
great. Thank you so much.
Right.
Thank you.
Right.
Thank
Good
you.
night.
Night, everybody.